Hello, my name is Kathleen. I'll be your nurse today. I'll be taking over for Sarah, who was your day nurse. I'll be your night nurse. All right? I'll be taking care of you for the next 12 hours tonight, okay? And a part of this, a part of this, I'm just going to do a focused assessment on you, okay? You initially came in yesterday for some, you came in yesterday through the emergency room for some mouth and throat pain while swallowing, correct? Okay. All right. So I would, and you also have a history of COPD. So I see that in your chart, and so I'll be also taking a more focused listen to your lungs, okay, today as well. Um, just to uh, kind of get started, I'm just going to provide privacy, okay, and I'm also going to perform hand hygiene. I have my supplies here, um, and your name is first and last name, okay, all right, and do you know what today is? Okay, all right, and do you know where you are? Okay, you do. All right, my patient is alert and oriented times three. Also, just looking at my patient, he looks mild mannered. I don't notice any unusual odors. I also don't notice any work of breathing just at looking at my patient, or I don't visualize any discomfort at this moment. Um, uh, Also, the complexion is appropriate for his ethnicity, his slash her ethnicity. Um, also, the pain that brought you in. Um, you said that it was throat and mouth pain, correct? Okay. And would you say, on a scale of 1 to 10, how would you rate that pain? 1 being the least amount and 10 being the worst. How would you rate that pain? Oh, a 6. Okay. All right. Okay. And when did that pain begin? Okay. A couple of weeks ago. I mean, a couple of days ago. Okay. All right. Okay. I'm glad you came, especially with the COPD, and we want to make sure everything's okay. Okay. All right. And anything make that pain worse? Okay. Okay. Anything make the pain better? Okay. All right. Okay. Uh, okay. All right. Okay. All right. And would you say, like, what that pain, what type of characteristics would you say, like, it's kind of like a throbbing, a burning, or tightening, or, what type of characteristics would you describe? Okay. All right. And are you allergic to any medication? Oh, penicillin. Okay. And what type of reaction do you get to that? Oh, anaphylactic. Okay. So we want to make sure that we stay far away from penicillin. Um, okay. And are you taking any medications? I see that you brought your inhalers with you. Okay. Okay. All right. Okay. All righty. And have you ever had surgery? Oh, you've had a hernia. Okay. All right. Sorry. Sarah also told me that as well. Okay. All right. Okay. And how's your I know the hospital can get a little loud, things in here. How's your stress and anxiety been here? It's been okay? Okay. All right. How's your support system? I know your wife came in with you yesterday. Okay. All right. Oh, everything's good in that area. Okay. All right. Let's see. All right. So let's just begin. I don't want to take up a lot of your time. I know that you were getting some rest. So I'm just going to first, I have already performed hand hygiene. I am first just going to take a look at you, okay? Just taking a look at you right now, just assessing your head. Um, your head seems symmetric. Um, you don't look like, and your skin looks appropriate. Um, your eyes are symmetric as far as on your face, as far as placement. Your nose is symmetric. Your lips are symmetric. Eyebrows are present. Eyelashes are present. I don't notice any extreme amount of sweat or discomfort coming from you right now. Um, I'm just now going to I'm just going to take a feel on your head, okay? And again, if you feel any type of discomfort during this procedure, please let me know. And also, I'm going to have you sit up a little bit, okay? Because of your history of COPD, it's actually better for you to kind of have more of an upright position, okay? It promotes healthy circulation in your lungs, okay? The oxygenation, okay? Make sure you can see us. Okay. All right. So I'm just going to take a feel in your head here. All right. Just feeling for any depressions or anything like that. Any pain at all? No pain there. Okay. All right. While I'm back here, I'm just going to feel for your lymph nodes, just feeling to see if I feel any enlargement of the lymph nodes, or on the neck if I feel any masses or anything like that. The skin is warm to touch, not febrile, but warm, normal, like normal temperature, and also not cold. Um, uh, just feeling here. Okay, all right. Also, now, while you're looking at me with those beautiful eyes, I am going to I'm going to test your oculomotor nerves here, and I'm also going to check your perla, okay? Uh, your, um, um, your, your cranial nerve 2 and 3. So I'm going to briefly shine the light into your eyes, okay? But just looking at my patient's eyes, the pupils are equal and round. Also, the sclera is white, no redness. Also, I'm just going to pull it down on your eyelid here. The conjunctiva is pink and moist the way it should be. All right. Okay, I'm going to have you, um, first I'm going to flash a light into your eyes, okay? I'm going to check to see if your pupils constrict, okay? All right. Beautiful. All right. Your pupils, you were sitting in the dark, so your pupils were originally about a 5. They constricted to about a 2. Now I'm going to check your right eye, my love. Beautiful. All righty. While I'm here, I'm just going to have you stare at my pen light, okay? I'm going to check your ocular motor, okay? Follow my pen light with your eyes only. Just checking to see if your eyes have healthy movement, okay? Beautiful. Making sure your brain is connecting, giving those signals to your eyes to follow that pen. Follow that pen. Perfect. All right, we got convergence, got accommodation, and we've got our perla. All right. And now, also, it seems like my patient has no trouble verbalizing and also no trouble hearing, because you've been able to respond to me clearly and effectively through our communication. Also, I can tell by your body language that you can understand what I'm saying. There are multiple ways that I can tell that my patient can hear. But also, have you ever had any difficulty hearing at all? No? Okay. And as far as your eyes, I didn't ask you, do you wear contact lenses or glasses? No? Okay. All right. I'm just going to take a look into this ear, okay? My pen light, I'm first looking at the external structures of the ear. They're all present. I also don't notice any drainage or discharge from the ear. No redness. All righty. Now I'm going to take a look at the other ear here. The external structures on the left ear are all present. I'm going to take a look into the ear. Alrighty, I didn't notice any drainage, redness, pus, or anything, and my patient shows no sign of discomfort while palpating and looking into the ear. Alrighty, now I am just going to and looking at my patient's lips, they're pink, which shows that we may have some good oxygenation going on here. Even though your O2 showed that it was 91%, we're going to keep you on your oxygen, your nasal cannula at 2, okay? Right now, you're looking good. You're about at 96%, okay? All right. I'm just going to have you open your mouth for me, okay? All right, and I'm just going to take a look at my pen light again. The oral mucosa is moist, um, pink the way it should be. The tongue is present. I'm going to have you stick your tongue out for me. All right, lift your tongue up and then down. All right, just both sides, move side to side. Awesome. All the teeth are present. No lesions are in the mouth. No unusual odors coming from the mouth. Um, have you any difficulty eating at all? Okay. No? Okay. All right. I know that you were having some pain in your mouth and in your throat when swallowing. I don't see any signs of redness or inflammation I don't see any signs of inflammation or redness or pain or infection that I can see. But sometimes, pain, some things we can't see. Okay. But I just wanted to make sure I took a good look in there. Okay. All right. And actually, stick your tongue up for me one more time and say, ah. Awesome. The uvula is present. Maybe a little bit of redness, um, but um, we'll I'll note that. Okay. All right. You said no difficulty eating or chewing. Go ahead and swallow for me, dear. Awesome. All right. Swallow reflex is there and present. All right. Okay. Now I am going to move on to your thoracic cavity here. Okay. Um, I know that you have a history of COPD. Okay. I'm just going to have you lean forward for me. Okay. I'm just going to just check the diameter of your chest. Okay. Because a lot of patients that have these respiratory conditions, these chronic respiratory conditions, tend to have more of a barrel chest because of the damage to the lungs. Okay, that permanent damage can causes the diameter of the chest to increase. Okay, you do have a little bit of a larger chest diameter, but I was expecting that. Okay, that's an expected finding. Okay. Now I am going to take a listen to your lungs, all right? But just looking at my patient's chest, I don't see any extreme work of breathing. Um, the rise and fall of the chest is normal. Um, this complexion is also normal, appropriate for ethnicity. I don't notice any unusual skin patches or discolorations. The temperature of the skin is normal and warm. I'm going to listen to the lungs first, okay? I'm going to listen to 6 spaces on the front, okay? 6 areas on the anterior chest wall. Take a deep breath for me. In and out. I'm going to move your arm over a little so I can get right over here. In and out. Beautiful. Opposite side. Awesome. Now, I'm going to have you lean forward for me, okay? I'm going to take a listen to your posterior lung sounds, okay? There are 8 areas on the back. Go ahead and hug yourself for me here. Breathe in and out. Nice. All right. Go ahead and lean back. You can go ahead and lean back, but stay in the upright position, okay? All right. Now I'm going to take a listen to your heart sounds, okay? Um, Now I know that you have some difficulties, sometimes maybe some discomfort with breathing because of the COPD. But as far as chest pain, any um, chest pain on physical during physical activity, maybe while you're lying on your side, on your back, things like that? No? Okay. All right. Okay. Any palpitations at all? Like unusual flutters that you feel in your heart at all? Ever? Okay. No? All right. Okay. Let's go ahead and take a listen. First area I'm going to listen to is the second intercostal space to the right of the sternum, which is the aortic valve. Good. Now I'm going to move over directly across from that to the second intercostal space to the left of the sternum, which is the pulmonary valve, pulmonic. Now I'm going to move to the third intercostal space on the left to the left of the sternum, which is Erb's point. Now I'm going to move to the fourth intercostal space beneath that, which is the tricuspid. Now to the fifth, which is the mitral. Sounds great. Now, while I'm here, I'm going to check for your apical pulse, okay? That's in the same area. I'm going to have you lie down for me. I'm going to move this one pillow. Thank you. Mid-clavicular, fifth intercostal space. Alrighty. All right, so while I'm here, we just checked for the apical. Now, while I'm here, I'm going to assess your abdomen, okay? I'm going to have you put both hands on your side, to your side. Um, just assessing, just looking at the abdomen here. There's no extreme work of breathing through the belly. Also, there's no extreme amount of distension. The skin is even tone and appropriate. No lesions or discolorations. And also, the skin is warm the way it should be, not febrile or too cold. Also, I'm going to check for skin tuber while I'm here. All right, skin tuber is nice. She's nice and hydrated. Nice, quick bounce back of the skin. All right. Um, now I'm just going to listen, okay, with my stethoscope. But before I listen, any issues with your bowels? Are you making your bowel movements every day? Yes. Okay. And the color is? Would you say that it's a solid brown form? Okay. All right. And not, even if you're not making it every day, that's okay. Everyone doesn't make a bowel movement every day, but as long as you're having it a couple times a week, or you don't feel any like you're constipated, then you're okay. You want to make sure that you're drinking adequate amounts of water. You know, 8 glasses a day. We try our best, but make sure you're eating your fruits and vegetables, keeping everything moving. Okay. Now I'm going to auscultate. Take a listen. There are 4 areas. I'm starting in the lower left quadrant. Lower right. Lower right. Nice. Now, upper right quadrant. Upper left quadrant. Wow. And now the lower left quadrant. Nice. Alrighty. Everything sounds nice, okay? Everything sounds nice and fluid in there like it should, okay? Now I'm just going to palpate, okay? Let me know if you feel any pain or discomfort during any of this, okay? Okay. Alrighty, dear. Now, before I get down to your lower extremities, I'm just going to check your radial pulses while your arms are here. Okay, both sides. They're not bounding. They're about a +2 to a 3. Nice. Now I'm going to check your brachial. That's about a 1 to a 2, 2, like 2, 2 plus. Nice. All right. Now I'm just going to move on down to your. Oh, actually, while I have your arms, let's do your range of motion up here. Okay. I'm going to have you put your arms out like this, like this, okay? Try to push me out. Nice. Okay. Try to pull me in. Nice. All righty. Okay. All right. Now I'm going to try to do the same thing with your legs, okay? All right. So I'm going to bring the leg up. I'm going to have you try to push me out. Nice. All right. Same thing with this leg. Try to push me out. Nice. All right. Now with your feet, try to push me down. Nice. With your feet, try to push me down. Nice. Beautiful. All right. Okay. Alrighty, dear. Now, with your, I'm also going to just check your range of motion. Oh, while I'm down here, I'm going to check your uh, posterior, posterior tibial pulse behind your knee, okay? I'm also going to check your pulses, your your pedal pulses on your feet. Right now I'm checking the pedal pulses on the feet. And while I'm down here, I'm checking for um, circulation in the toes. Less than 2 seconds capillary refill. All right. And your fingers. Let me take a look at these fingers here, my love. All right. I'm just checking for capillary refill, okay? All right. Less than 2 seconds. And actually, while I have you here, um, go ahead and squeeze my fingers as hard as you can. Nice. Over here as hard as you can. Nice. Okay. All righty. Um, now, the doctor is getting ready to come in. And, hi, Dr. Sabir. I'm just going to give my SBAR right now. Um, Mr. Wheeler arrived in the clinic yesterday accompanied with his wife with complaints of difficulty swallowing and pain in the throat. Ms. Wheeler is 64 years old. She has a history of COPD, diagnosed 5 years ago, and has been to the unit before for chronic management of his COPD. Ms. Wheeler is complaining of difficulty swallowing and pain in the throat and mouth, and that it has been bothering her when eating and drinking for the last 3 days. He bought both of his inhalers and the portable oxygen tank from home and states that he has been taking his medication as prescribed. We have taken a blood sample for CBC and BNP as ordered. The hematocrit is increased due to his low oxygenation levels. At his arrival, vitals were temperature 97.5 degrees Fahrenheit. Blood pressure was 104/62, taken on the left arm. The heart rate is 97 beats per minute. Respiratory rate is 19 breaths per minute. And his O2 saturation was 91% on room air. Now it's 96% on 2%, 2 liters. During his lung assessment, I auscultated crackles and wheezes, and his chest diameter has increased since his last time here. Miss Wheeler is in the room. I have educated and instructed him on the use of the incentive spirometer, which he is using every hour along with deep breathing techniques. I recommend ordering an ABG to get a more in-depth look at his oxygenation status, as well as a chest x-ray. He is drinking cold water, which temporarily soothes his mouth and throat pain. He's still on 2 liters of oxygen. All right. And I'll be waiting in the hallway if you want to add any more orders. Thank you.